reasons that we're providing you this series. It's over 4 hours of content, usable, practical, and applicable information for especially for your older clients that struggle with chronic shoulder and neck issues. And if you're a fitness professional that struggles with chronic neck and shoulder issues like I did for lots and lots and lots of years, and you've tried a lot of the common exercises, rehab, therapeutic type exercises, and they haven't worked, this information will also apply to you. So thank you for joining us. Thank you for allowing us to serve you. We're sharing this information with you so that you use this time of lockdown strategically to up-level your education, your skill set, and be that leader for your current clients and your current community, and attract more individuals that need, want, and will ultimately pay you for your expertise, even if you're experiencing struggles with your business like most of us are right now. So thank you for taking this time and applying it to up-leveling your knowledge. Now, one of the things we discussed in part 4 of this 4-part series, I'm going to leave a link for this series next to this video as soon as this video is done. You can also post your questions. I'll answer all questions. And if you like the information, feel free to share it with your like-minded colleagues. And if you don't agree with it or don't like it, be kind. You know, you can tell me you don't like it and it sucks and it's not usable. That's fine. But just don't be mean about it. So just, if you like it, share it. Let us know. If you have questions, like I said, I'll answer any questions that you leave if it's appropriate, okay? So now the topic that I'm discussing here today that one of the individuals asked me about, you discuss in your series why YWTs don't always work for your clients. So when I went to physical therapy over 22 years ago, I went to chiropractic rehab, then I went to physical therapy, traditional physical therapy. I went to tons of resources, I should say the continuing education courses talking about the shoulder, and virtually every single one of them, bar none, taught me to scapular retract, to stretch my chest out, to squeeze down and back, to lift my chest up, to do I's, Y's, T's, and W's, and all those exercises, and do them with heavy resistance. And it's still a popular training ideology here today. So why don't we do them, and why do we do them very infrequently with our clients and patients? So it's really understanding scapular control, and that's what we've been sharing with you on Two Anatomy Geeks, this shoulder series, because it's important that you understand 3 things. Functional anatomy, basically where muscles are, how they fascially attach and work together. Biomechanics, how the biomechanics of the shoulder, head, and neck all relate together to create and maintain optimal alignment and control of the shoulder complex. And then also motor control. And I'm really going to touch on motor control, and that will explain to you exactly why we do not do I's, Y's, T's, and W's with a lot of our clients. And if we do, it's a very few select clients, and we do it with modifications. I'll share that with you here today as well. So, first thing you gotta understand is the forward shoulder. Now, let me just say one more thing before I share this with you. There's a lot of people out there on the internet right now that are saying things like posture doesn't matter. Corrective exercise is a waste of time. You can't make people perfect. Well, that's great, but if you look at the definition of evidence-based, evidence-based does not mean all you do is look at the research. If you look at Dr. David Sackett's definition of evidence-based, Dr. David Sackett came up with this definition back in the 90s. So I'm taking his words, I didn't make this up. It's the combination of the best external evidence, so the best research, okay? It's also, however, your clinical expertise and experience. So it's the best external evidence, it's your experience and expertise, and it's also your client's expectations. It doesn't mean that all you look at is the research. Research is important. It validates what we do. It doesn't invalidate what we do. So when people start to say, oh, posture doesn't matter or corrective exercise doesn't matter, they're not reading all the research. They're cherry picking and using evidence-biased research. They're not actually looking at all the research because there's lots, hundreds and thousands of studies that actually prove that motor control actually is important, that posture actually does matter, that corrective exercise actually does make a difference with people. So I'm off my soapbox now. Now, the forward shoulder. Now, when we think about the forward shoulder, what actually is the forward shoulder? And this is why it's so important that you use this information and understand it and help educate your clients on this. It's not just like your shoulders forward and then you just need to pull it back. That's where we got to because people would see the forward shoulder and say, oh, if it's forward, just pull it back. But the problem is if we actually understand what the forward shoulder is, you'll see why that does not work for a lot of clients and why it actually led directly to my shoulder problems, bilateral rotator cuff tears, bilateral labral tears, doing exactly what I was taught in chiropractic rehab as well as physical therapy. And here's why. The forward shoulder is downward rotation and anterior tilt. That's this position right here, downward rotation and anterior tilt. So if you think about that position, it's where the scapula is come away from the rib cage. So this is imagine the client is facing away from the camera here. The scapula, this is the right scapula. The scapula has come down into this position and anterior tilted. So this position right here, anterior tilt is that way. Downward rotation is this direction right here, just like this image is showing you on the screen. Now, think about this. You have this client, that's your client right now. You have taught her to squeeze down and back. Which direction is her scapula going to go when it's already positioned in this position? It's already positioned in this position. When it's already aligned in this position. It's basically going to go more into downward rotation and anterior tilt. Yes, you will strengthen the scapular retractors. You will strengthen the scapular depressors. But is this the alignment you want to strengthen the scapula in? And if you still don't believe me, and if you still want to argue with me that posture doesn't matter, let's take a look at another slide. So this is my client, Melissa. Melissa has had a history of chronic right-sided neck and shoulder problems. Currently, we've been working with Melissa. She's done a great job applying the principles of the integrative movement system, the ABCs, alignment, breathing, and control. So she has currently no neck and shoulder problems, except for we shot a couple videos the other day, and in the videos, I had her purposely do things that are wrong. This is actually part of the exercise that I had her do wrong. And what happened is she calls me up the next day. She's like, I don't know what I did yesterday during our session, but I have a crazy headache and my shoulder pain and upper back pain is back because I had her doing, no joke, 3 sets of incorrect exercise. So it doesn't take weeks and months and years to jack people up. You can jack people up in 3 sets if they're prone to this issue. So I want you to watch this. The volume will play. I'm going to take a sip of water while the video is playing.
It's a very popular rehab type exercise. A band pull apart with scapular retraction. So I'm going to have Melissa do this motion with a light resistance band. So this is a pretty light green resistance band. And what you're going to see is when she goes into scapular retraction, go ahead. You'll see her do nice scapular retraction, but it doesn't look as good as it did without resistance. And now I'll have her bring her arms slowly back to the start position. And you start to see that she's not really controlling that scapula so well. Do it again. And again, this is a very light resistance for Melissa. She can easily do this, but you start to see non-optimal alignment and control of her scapula through this motion. One more time. And again, she's really just using a slight or light resistance during this motion. One more time. And just watch this right scapula especially. The left one's not so bad, but the right one is not really well controlled at all. Now, that's light resistance. Now, Melissa, let's grab it a little narrower. Let's bring a little more resistance to this and see what happens with more resistance. Because a lot of your clients, especially clients that are in the strength and conditioning industry and clients doing CrossFit and powerlifting, have been taught to work these scapular retractors. Do it one more time, Melissa. And again, you should see a lot of non-optimal alignment and control of this left, I should say her right scapula, and then release. And then one more time. And then release. And especially as she releases, you start to see that she's not controlling that scapula at all. And each repetition, it gets worse and worse. Now think about your clients using way more resistance than what Melissa is using here, or doing way more repetitions, or actually creating fatigue as she's doing this exercise. So it's very important that we understand that the issue for the majority of our clients with scapular, neck, and upper thorax issues, it isn't a strength issue. It's really a motor control issue. And scapular retraction with resistance doesn't train motor control unless you've already worked on the motor control aspect of the movement.
So this is a client that called me up. Actually, we were doing Zoom sessions years ago, consultations online. He called me up. He's like, I have right-sided neck and shoulder problems, and I have burning down my right side, neck and shoulder. This is a physical therapy exercise. This physical therapist gave him this exercise to basically hold his arms here, grab a resistance band, and go like this. And he's like, yeah, my neck and shoulders aren't getting better. And the only difference between you and I, hopefully there's lots of differences, but the one difference I should say is I get to see my clients without their shirts on, appropriately without their shirts on. So I see what happens. I can feel, put my hands on and feel what happens. And you can see a very different appearance between these two shoulder blades. So when other industry gurus are trying to tell you that posture doesn't matter, please stress to them, this, you can see it, it's obvious. He has burning in his neck, burning in his shoulder. It hasn't resolved with physical therapy because he's not doing the appropriate exercises. It does not mean his physical therapist is a bad person. It just means that he's not doing things that are appropriate for a shoulder. And here's what I want you to take home from this. It's not a strength issue. These patients do not have weak scapular retractors and weak scapular depressors. So if it's not strength, what is it? It's a motor control issue. And this is what we teach during our certification courses. This is what I want to share with you here so you understand it. Take a screenshot of this, save it. You cannot use concentric bias exercises like scapular retractions, like YWTs and Ws, to change a motor control issue. Motor control is all about teaching your brain how to align and control the body part that you're looking at. And this is not teaching him how to align and control his scapula. So, what do? We use very specific exercises to teach our client how to open and control that shoulder blade. We've shared many of them with you over the last few weeks here on Facebook Live, so feel free to check out our Facebook Live, our fitness education seminars YouTube page, as well as sign up for Two Anatomy Geeks, this shoulder series where we covered the shoulder anatomy and discuss all the corrective exercise patterns that we use with our patients here in our clinic. Now, what if you still want to do YWTs and Ws? Because some physical therapists still recommend that, and they may come to you as a fitness professional and say, hey, my physical therapist, your clients will come to you and say, my physical therapist has me doing these exercises, and you may look and say, oh yeah, I see exactly what Dr. Osar is talking about. So how can you make this exercise a little bit more effective for your client? Well, first, you start with the principles of the integrative movement system, the ABCs. First, you will help your client align, breathe, control. And remember, it's really about motor control. It's not about jamming the scapula back into retraction and or depression. It's about teaching the client how to control. So I'm setting myself up for success. I align and control the head, neck, and thoracolpelvic cylinder. I hinge over a bench. You don't need a bench, but I hinge over the bench. I grab a light resistance band, and now I'm doing more of like a Y pattern. I make sure I maintain my alignment. I make sure I maintain a nice open and wide shoulder position. Again, this is a progression. I've done a lot of work to get to this progression. I don't even use this exercise, but I'm just trying to demonstrate it. And you'll notice like during the eccentric phase, I'm not letting go of the control. And that's the problem with some of these concentric bias exercises is people are losing the eccentric phase of it, and that's a motor control issue, not a strength issue. So I hope this served you. I hope to help educate you as to why Ys and Ts and Ws just don't work as well for every client. If you found success with them, obviously keep using them. If your physical therapist or chiropractor or medical doctor has recommended that, don't tell your clients to stop doing them. That's irresponsible and out of your scope of practice. So make sure you work within your scope of practice, help educate your clients, help empower your clients, and help them excel at their posture and movement strategy. And that's how you become the specialist, the go-to specialist for your current clients and attract more individuals that need, want, and will pay you for your expertise. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thank you so much for keeping an open mind, for joining me here, and for all you do for your community.